Bonjour, merci. Hi, and thank you. I want to start off by giving a big shout out to the over 200 doctors in Ontario that are raising alarm bells about the crisis faced by seniors in long-term care, the crisis that's been there for a long time, but it's been exposed by COVID-19. They're calling for urgent reform, specifically improved staffing hours, improved conditions for workers, and as well removing profit from long-term care. The evidence is overwhelming. Profit in long-term care directly has led to increased infection rates and death of seniors in long-term care. We're losing our loved ones because of profit, and it has to end. So that's why today I called on the federal government again to take the first step. One of the largest for-profit long-term care providers is Rivera. Rivera is owned by a federal agency, so the federal government has the power to immediately make this public, work with provinces to deliver public service, and save lives. In addition, we know that the delays with vaccines and vaccination means more seniors are dying. I mentioned those 200 doctors. One of them mentions the fact that Dr. Dasani talks about nearly one senior every day dying because of COVID-19. That has to end. Vaccinations are a big part of it, but we're worried about the delays and what that means. So again, we're calling on the government for a clear plan for procurement and delivery and vaccination. Donc, aujourd'hui, on a plus de 200 médecins qui exigent des actions concrètes, des actions urgentes pour faire face à la crise dans les centres de soins de longue durée causée par la COVID-19. Elle exige des réformes concrètes, mais un exemple, c'est d'enlever les profits dans nos centres de soins de longue durée, parce que c'est clair, il y a beaucoup de preuves qui montrent le profit crée les conditions horribles pour les résidents des centres de soins de longue durée, et ça inclut plus de propagation de la COVID-19, mais aussi les morts causées par la COVID-19. Donc, on exige le gouvernement fédéral de commencer de prendre un pas pour enlever les profits en réglant la situation avec Rivera, qui est propriété d'une agence fédérale. Le gouvernement fédéral a le pouvoir de le rendre public et de s'assurer qu'on sauve les vies. Donc, on exige le gouvernement de commencer d'enlever les profits dans le système de soins de longue durée tout de suite. Deuxièmement, avec les délais pour la vaccination, ça crée des grandes inquiétudes pour nous et pour nos aînés parce qu'on sait que c'est eux les plus vulnérables qui en ont besoin et on doit agir maintenant avec urgence pour créer un plan concret et un plan de livraison et de procurement du vaccin. Donc, ça, c'est essentiel aussi. Je suis prêt pour vos questions. I'm ready for your questions as well.
So we'll now take questions, starting with question on the phone for about 10 minutes. One question, one follow-up per reporter. Nous allons maintenant commencer la période des questions. Commençons par les questions au téléphone. Pendant à peu près 10 minutes, une question suivie par journaliste. Operator, do we have a first question?
There are no questions on the phone.
And we'll go to the room. David?
Hey, Mr. Singh, thanks for coming down and answering our questions.
Of course.
So we're seeing over the wires that the EU is considering a proposal to control or to count the amount of vaccines that are leaving their country. Can we get your reaction to that? What do you think, this means for Canadians and possibly getting the Pfizer vaccine, which is coming from Belgium?
Deeply concerned, very, very worried about what this means. We already know that the delays mean that less people get vaccinated, particularly the most vulnerable. We already know that the conditions in long-term care are continuing to be very difficult, very horrible conditions for seniors. We're worried about what this means. So we need to see an immediate plan, given this bubbling up, these concerns being raised about a limit on vaccines coming to Canada. Already with existing delays, we need to see a clear plan that addresses not only this delay, but the potential of an additional delay if there's any limits on medication or vaccines traveling from the EU or Europe to Canada. So we need a clear plan. We've been calling for a clear plan for a while. That's been one of the mistakes that this government has made. They haven't provided a clear, detailed plan like other countries have.
So a clear plan is what you want, but haven't we seen somewhat of a clear plan? 6 million doses they're expecting by the end of March, vaccinating all Canadians by, by the end of the year, September. This is a very complicated issue with supply chains and stuff like that. So, there's only so much that the government can do. So what more do you want to see in that plan?
Well, a plan is not sufficient if it's just about the results. We need to know how they're hoping to get to those results. So to get to everyone being vaccinated by September, what does that mean each month? How many vaccines does that require? How many people need to be vaccinated? What is the timeline? And what does a rollout look like? To achieve the outcome of a plan, we need to know what are the steps along the way. And that's where this government has really failed. The Liberal government, Justin Trudeau, hasn't laid out monthly targets, a clear plan of what's to be achieved each week, so we know whether we're on track or falling behind. That type of detail is what's missing. The vagueness of achieving an end result in months down the road without having a map to arrive at that goal is the problem.
Check if we have if we have a question on the phone first. Operator?
Thank you. Our next question, la prochaine question. Émilie Bergeron, Agence QMI. Your line is open. À vous la parole.
Oui, bonjour, Monsieur Singh.
Bonjour.
Bonjour. Je voudrais savoir ce que vous pensez de l'idée d'essayer d'avoir des discussions avec Pfizer pour obtenir des doses du Michigan au lieu de les recevoir d'Europe.
Pour moi, ce n'est pas important d'où viennent les vaccins, mais on a besoin de garanties concrètes qu'on va recevoir les doses suffisantes pour vacciner toute la population. Donc, c'est exactement ça. On a besoin d'un plan, mais le plan peut inclure les autres vaccins aussi, mais on doit avoir un plan clair comment on peut arriver au scénario où tout le monde est vacciné. Et c'est quoi le plan pour chaque mois, pour chaque semaine, pour y arriver?
En suivi par rapport aux restrictions supplémentaires que M. Trudeau dit qu'il va annoncer bientôt, bon, ça fait plusieurs jours qu'il dit que ça s'en vient bientôt. Comment réagissez-vous à ce délai-là?
Vous parlez de limites sur les voyages?
Oui, exactement. Là, plusieurs possibilités. Donc, oui. Soit les limites de voyage ou la quarantaine okay. À l'hôtel, par exemple.
Oui, bien sûr. Donc, je suis d'accord avec les mesures comme ça. On a vu aux autres pays comme Nouvelle-Zélande, ils ont mis en place une telle mesure comme quarantaine et aussi des limites de voyage non essentiels. Mais je veux souligner, pour moi, la priorité basée sur la preuve et sur les opinions des experts en matière de santé publique. C'est l'enjeu le plus important, c'est la propagation de la COVID-19 dans les milieux de travail. Donc, si la plus grande menace, c'est les milieux de travail, les experts en matière de santé publique disent qu'on doit améliorer accès aux congés de maladie payés. Ça, c'est pourquoi on a dit que, basé sur la preuve, basé sur les opinions des experts, on doit améliorer le congé maladie payé qui existe et on propose des solutions concrètes pour le rendre plus flexible et pour augmenter le montant. Tous les détails qui vont vraiment aider l'arrêt de la propagation de la COVID-19 dans les milieux de travail.
Opératrice, prochaine question.
We have no more questions on the telephone lines. Nous n'avons plus de questions.
Last question in the room, David.
Mrs. Singh, I know you don't like to comment so much about like the processes of the House and stuff like that because, you're focused on getting results to people. People aren't too interested in the Byzantine operations of the House. But I noticed that everyone's wearing a mask when they're at their seat. So something has changed there. Can you comment about that? If among the members, you all have decided to adopt a certain behavior when you're in the House?
I think in light of the lockdowns in Ontario, there is a heightened worry now with the different variants that are now being identified in Canada. We're more worried. I think there's a heightened heightened vigilance, and I'm proud to say that there is now a culture adopted in the House of Commons where everyone is wearing a mask while seated. I think this is an example of showing leadership in the sense that we're all in agreement that we need to do everything we can to reduce the spread, and wearing masks when we're close together in the House of Commons, even though there is a great distance between us, I think it's an additional measure that is a good one.
And thoughts, because I just in looking at how the attendance at QP physically there, I noticed on the government side, at least yesterday, there was only one MP from the government side there. What are your thoughts on that? Even though people are attending virtually, do you have any thoughts about maybe whether that's working, whether that there are any shortcomings with that, or yeah?
I appreciate off the top that you notice that I like to speak about the help that people need as opposed to and so that's appreciate you noticing that about me. But I can comment quickly. I think reduced numbers now make sense. We have reduced down to 2 people as well. The government is today at 2, and I think it makes sense to have less numbers in the House. We can attend virtually, vote virtually, and I think that's important. So that's what we've been doing, and I think whatever we can do to keep people safe is important.
Awesome. Thank you, Mr. Singh.
Thanks.
Thank you very much.
Thank you.